Alrighty, I'm on my way in, parked in the parking garage because it is raining, but it's time to start another shift. This is the beginning of my weekend shift. Let's see. How lazy am I to take the elevator? But I'll be lazy today. I'll be up for 12 hours. So let's get this show on the road. I am going to clock in, put my things away, and then I'll have approximately 7 minutes until it's time for huddle. I get my patient assignment, go to huddle, then it's on to get to report. The wonderful thing about the weekend, working 3 days in a row, is you usually give a report to the same nurse, and the same nurse gives a report to you, which makes things awesome and go by a lot faster. So definitely love that. Then it's time to get the shift started. This is day 2 of 3. So it's another day and another dollar with Icurnvus, and I am back at it again. Right here you see me starting my shift. I have gotten report, and I have been into all my patient rooms and introduced myself to my patients and their family members. Go back to the computer and check out any treatments and medications that I have to give, and it's time to get started. So here I am getting ready to check the patency of an IV, and that's one of the things that I wanted to talk to you all about tonight. It is so important to make sure that you have a patent IV before you administer any intravenous medications and any central line medications. So I try to check patency for all of my IVs, of course, before and after every administrations of an intravenous medication, also at the beginning of my shift and at the end of my shift, to ensure patency for the oncoming registered nurse. I believe that it is super important, and also to make sure you maintain aseptic technique in doing so. So you make sure that you use an alcohol swab to clean the external port to the IV, and then you flush with about 3 to 5 cc's of normal saline solution, or whatever your facility policy is for flushing IV lines. And then of course you want to clean again with an antiseptic swab, and then cover it with a swab cap. So here I'm getting ready to administer a subcutaneous heparin injection. And as you guys know, I'm a stickler for aseptic technique, so I am taking the antiseptic alcohol swab and cleaning the port at the top of the bottle. Even though it's a new bottle, I still clean the top of my bottles. Then I am going to use an insulin syringe to administer the subcu heparin. Now, subcu heparin is a anticoagulant that is administered subcutaneously on a daily basis, sometimes twice a day, to patients to ensure that they don't get blood clots. And it's administered just like Lovenox in the love handles or the lower abdominal quadrants, alternating sides with each administration. I am going to draw up the amount equal to what I will pull out of the vial, pressurize the vial with that air, and then invert it to remove the heparin from the vial. Now, when pulling medication up in this type of needle, you want to make sure that you take your time. The needle is actually quite small, or the orifice or the hole in the needle is very small, so it's going to take a little bit of time for you to get all of the medication out of the bottle. Then you want to make sure that you also use an antiseptic skin swab, like an alcohol swab, to cleanse the skin prior to administering the injection and allowing it to dry, just for the comfort of the patient. And also remove the air from the syringe before administering. Now here you can see me recapping this insulin needle, and even though it seems a little cumbersome and time consuming, that is the appropriate way to recap any needle. That reduces the risk of possible needle stick injuries. So there is my antiseptic skin swab, and it is time to administer slowly my heparin solution. And then, as you can see, that needle also had a safety engagement device to also reduce the risk of needle stick injuries. So now I'm going to take you on a tour of the hospital supply room. The hospital supply room here is pretty standard. You've got your linen cart with your linens on it, your sheets and blankets, fitted sheets, bath blankets, and draw sheets, pillowcases, and gowns, washcloths, and towels. And the linen cart should actually always be covered. Then you have our blanket warmer. We actually put blankets and sheets in there to warm up for patients, which is particularly used for patients that are going to dialysis in the mornings. Here is our cabinetry where we have lancets, swab caps, chloroseptic swabs for blood cultures, hemocoat solution. We have insulin syringes up here. We also have tuberculin syringes. And there's the lancets and swab caps again, the chloroseps, and the orange top would be our bleach wipes, and then the gray top would be our disinfectant wipes. This forms our bath wipes and CHG wipes. CHG wipes are used to bathe patients prior to surgical procedures. Here are some 3 milliliter empty syringes that we use along with a drawer full of 10 milliliter syringes, both empty. We can use them to draw up medications for intravenous administrations and also for IM administrations or intramuscular. These are the lab totes that we utilize with the tubes and the butterflies and the vacutainers and our biohazard bags, gauze and bandages, and also alcohol swabs that we use for our labs, because at this facility we do our own labs. We don't have phlebotomists that come up and do it for us. Down in the cabinet you can see a big box of vacutainers that we use to draw labs, and I've just taken out some 10 cc normal saline syringes that I need on my cart. So here you see some intravenous solutions in our Omnicell. The Omnicell we use here just for materials management that we will pull out and scan to charge to the patients. You can see here some large bags of solution that you won't see on other units because I work in nephrology and renal unit, and we use those fluids to do peritoneal dialysis. There's also other things like IV tubing, blood set tubing, telemetry, electrodes, toiletries, socks, in and out catheterization. There's our screen that we pull up our patients on, and there's a scanner right below to scan not the medications but the materials out to charge to patients. Patient wedges for turning patients, gowns for isolation rooms, urinals, and things of that nature all are in the supply room. And I'll probably do another supply room tour where I can get a little bit more in depth about the things in there. So another thing that I wanted to discuss about nursing is what the job consists of. So whether you think that it's a easy profession or not, I'm here to tell you that we spend about 90% of our time on our feet, whether we're standing or walking to perform different duties and tasks throughout the night. Sometimes you see nurses sitting, and a lot of people think all we do is sit. But when we're sitting, we're probably charting and documenting, and that's super important because I worked Blue Cross Blue Shields as an RN appeals analyst, and I just so happen to know that documentation is so important because it oftentimes is the indicator of whether the hospital receives payment for the services provided. So adequate and accurate documentation is very important. So now I'm going to show you the Pyxis, or our medication dispensary system, where we pull medications from. You can actually assign your patients to yourself, so every time you open the screen and use your fingerprint to sign in, your patients will basically matriculate and your patient list will be available to you very readily. You click on your patient name or you tap on the screen and it will open up the correct drawers, and within those drawers there are cubbies that house medications. Be careful though and make sure that you pay close attention to the screen, because if dosages changes, the screen will be the thing that tells you how many pills to take out, or whether you need a half a pill or 2 pills or a whole pill or whatever. So just make sure that you pay close attention to that whenever you're pulling medications from the Pyxis. So it's about time for me to get out of here. I've had a pretty good shift, but I am tired. And yes, I've got to get home, get to bed, so I can do it all over again. Make sure you like, comment, share, and subscribe. And hit the notification bell to see what Browns All Around will be next. Thanks for watching. Bye, guys. And that concludes the end of another shift. Please stay tuned, like, comment, share, and subscribe to see where Icurnvus is next.